everyone. In this class, we'll study about biliary secretion. Learning objectives would be give the composition and function of bile, list the difference between hepatic and gallbladder bile, name bile salts and acids and give their functions, understand the importance of interhepatic circulation, outline the mechanism and regulation of bile secretion, comprehend the physiological abnormality in gallstone formation, Hepatobiliary system. Bile is formed in the liver and excreted through the bile ductules. The bile ductules, along with branches of portal vein and hepatic artery, form portal triad. The portal triad opens into hepatic sinusoids and are surrounded by hepatocytes. The bile canaliculi opens into bile ductules, then forms bile duct, which leads to hepatic duct. The right and left hepatic ducts to join to form common hepatic duct. Cystic duct combines with the hepatic duct to form common bile duct, which combines with the pancreatic duct and opens to the second part of duodenum through sphincter of Oddi. So this is the components of hepatobiliary system. You can see the right hepatic duct and the left hepatic duct, which is going to form common hepatic duct, which is going to join to the cystic duct to form the common bile duct. Okay, whereas these are going to open in the duodenum through the sphincter of Oddi. Composition of bile. About 0.5 to 1 liter of bile is secreted a day. The bile is yellow greenish due to the presence of glucuronides of bile pigments, that is bilirubin and biliverdin. The pH of hepatic bile is about 8, but the bile secreted from gallbladder is mildly acidic. It is composed of water 90% and solids that mainly include bile salts and bile pigments. So if you see the composition of human bile, it has bile salts, bile pigments, cholesterol, inorganic salts, fatty acids and fat, alkaline phosphatase, cations like sodium, potassium, calcium, magnesium, anions like bicarbonates, chlorides, sulfates and phosphates. Hepatic and gallbladder bile. There are differences between hepatic bile and gallbladder bile, as bile is concentrated and acidified in gallbladder. Water absorption is the major mechanism for concentration of bile that occurs secondary to sodium absorption by secondary active transport. Sodium potassium ATPase in the basolateral membrane of epithelial cell lining transport sodium actively uh, out of the cell and creates a gradient for sodium transport into the cell. Water is reabsorbed passively by the osmotic gradients created by the sodium movement. Hydrogen ion is exchanged with sodium that causes acidification of the bile. So these are the difference between hepatic and gallbladder bile. Hepatic bile is alkaline and the gallbladder bile is acidic where the pH is around 7. Water content here is 98%, here gallbladder it comes down to 85%. Solids 2 grams here and 10 to 15 grams here in gallbladder bile. Bile salts and pigments they're less, here they are more. Bile acids. The primary bile acids are cholic acid and quinodeoxycholic acid. The primary bile acids are formed in the hepatocytes from cholesterol. Secondary bile acids are deoxycholic acid and lithocholic acid. The secondary bile acids are produced in the intestine, where intestinal bacteria convert primary bile acids into secondary bile acids. Bile salts are the sodium and potassium salts of bile acids. Bile acids are conjugated with taurine or glycine to form taurocholic acid and glycocholic acid. These acids then combine with sodium and potassium salts to form sodium taurocholate, sodium glycocholate, potassium taurocholate, potassium glycocholate respectively. Functions of bile. So they help in the absorption of the fat. Bile salts are essential for absorption of fat from intestine. This depends on the formation of micelles by bile salts in the intestine. Lipids are transported in micelles from the lumen into the intestinal mucosal epithelial cells where micelles dissociates and lipids are absorbed. They help in the emulsification of the fat. Bile salts are surface tension reducing agents. Along with phospholipids and monoglycerides, they cause emulsification of fat, which is essential for digestion and absorption of fat. They, they're the source of bile acid. Bile salts are converted into bile acids in the intestine, which are then absorbed into the portal blood. Thus, bile salts are important sources of bile acids that add to the bile acid pool of the body. So they important for bile secretion. Bile salts are important cholerectics. They are they are constituent of bile and also they stimulate the bile secretion. Absorption of fat soluble vitamins. Bile salts facilitate absorption of fat soluble vitamins like A, D, E, K. They help in the activation of pancreatic enzymes like pancreatic lipase. So they help in the prevention of gallstone formation along with lecithin, which solubilizes the cholesterol. So thus they prevent formation of the stone in the gallbladder. They act as a physiological purgatives. Bile salts act as a physiological purgatives. The constipation occurs in conditions of deficiency of delivery of bile into intestine as it occurs in obstructive jaundice. The bile salts add natural brownish color to the stool. The bile salts maintain the bile maintains pH of the intestinal content and prevents the overgrowth of bacteria in the intestine. Interhepatic circulation. Bile acids and bile salts are absorbed from the intestine and re-excreted in the bile. And this cycle is repeated so many times, so which is called as enterohepatic circulation. Bile salts are produced in the liver around 200 to 500 milligrams per day and conjugated and then enters intestine. From intestine, they are absorbed into the portal blood to reach liver. Also in the intestine, the conjugated bile salt is deconjugated and unconjugated bile salt is absorbed into the portal circulation. The free bile acids in terminal ileum and colon by the action of bacteria are converted into secondary bile acids. So this is a diagram showing the intrahepatic circulation where the synthesis of bile acids. Okay, so initially it is conjugated um, and conjugated here. This conjugated bilirubin deconjugated and the bile uh, acids or they're going to enter into the portal circulation. Some free bile acids is also conjugated. I mean, under the influence of bacteria, they gets converted into secondary bile acids, and some of them they are reabsorbed into the portal circulation. Okay, and so again, those recirculated uh, bile acids and bile salts, they again they enters into the biliary tract. So this kind of circulation is called as intrahepatic circulation. So this occurs for both bile salts and as well as bile acids. The secondary bile acids are also reabsorbed into the portal circulation. So thus from gut about 95% of the secreted bile and bile acids are transferred back to the liver via portal circulation. And only 200 to 500 milligrams a day of bile acids are excreted from the stool. From liver, again they are excreted through the biliary tract into the intestine. So this forms the loop pathway for enterohepatic circulation. Importance. The primary function of enterohepatic circulation is bile acids and salts to maintain the total bile acid pool in the body. The total amount of bile acids that is conjugated and unconjugated and primary and secondary in the body ranges from 2 to 4 grams. The bile is recycled several times a day during meals so that small pool of bile acid can efficiently provide enough bile salts to facilitate adequate lipid absorption from the small intestine. Though absorption of bile acids and salts from intestine occurs efficiently, some amount is lost with every cycle of passes through the intestine. So this accounts for loss of about 500 milligrams of bile acid daily, so which is replenished by synthesis of new bile acids from cholesterol. So thus fecal excretion of bile acids account for an efficient medium for loss of body cholesterol. Determinants of intrahepatic circulation are integrity of the intestinal epithelium. Bile salts are reabsorbed mainly in the terminal ileum by an efficient carrier mediated process, so that only 5% of the intestinal bile salts enter the colon. Also, in the intestine, bacteria deconjugate the bile salts to bile acids, and bile acids are absorbed passively and easily as they are more lipophilic than the bile salts. Thus, intestinal absorption of bile acids and salts into the portal blood is an important determinant of enterohepatic circulation of these substances. Further, bacteria convert primary bile acids to secondary bile acids that they also absorbed into the portal circulation. Therefore, lipid malabsorption occurs in chronic inflammatory condition of intestine. It also depends on efficiency of hepatic intake. In the portal blood, bile salts are transported bound to HDL or albumin. Once they reach the liver, hepatocytes efficiently pick up bile salts from hepatic blood, which accounts for removal of more than 80% of the total bile salts. So this hepatic uptake of bile salt is an important determinant of secretion of bile salts in the bile. So thus hepatic uptake is the determinant of efficiency of enterohepatic circulation of bile salts. Coming to bile secretion, uh, the mechanism, bile is formed in hepatocytes. Bile acids are taken up from the sinusoidal blood by transport proteins that are present in the basolateral membrane of hepatocytes. In cytoplasm of hepatocytes, bile acids bind with uh, bile acid binding proteins. Okay, so bile acids are conjugated with glycine or taurine and then secreted into lumen of hepatic animalculi by facilitated diffusion. Bile acids move into bile down their electrochemical gradient. The concentration gradient is maintained by formation of micelle in the bile present in the canaliculi. Mechanism of water and electrolyte secretion. The bile duct epithelial cells secrete bicarbonate rich fluid into the lumen, and it will be modified uh, in the gallbladder. Bile is continuously synthesized and secreted from the liver, and it is stored in the gallbladder. The gallbladder is a small sac like structure which has a capacity of around 30 to 60 ml. The gallbladder performs three important functions, that is, storage of the bile, acidification of the bile, and concentration of the bile. So the hydrogen ion is secreted from the gallbladder epithelial cell into the bile to make the bile more acidic. The H plus ion is secreted into the lumen of gallbladder in exchange of sodium, that is by sodium hydrogen exchanger for sodium transport into cell. The gradient is created by sodium potassium pump located in the basolateral membrane of the epithelial cells. So, so that causes the secondary active transport. Water is reabsorbed from the gallbladder so that the bile gets concentrated. So this is how uh, there will be absorption of the sodium and excretion of the hydrogen ion. So that occurs mainly because of the active sodium hydrogen potassium pump, so which creates the gradient for sodium, and sodium moves in. With that, the H plus ion is antiported. Okay, so with the movement of the sodium, water also moves inside. So that makes the luminal secretion more concentrated. Regulation of bile secretion. The bile secretion is influenced by cholerectics and cholegogues. Cholerectics, these are the substances which enhance the secretion of bile, are called as cholerectics. The important cholerectics are bile salts, secretin, so which is going to increase the aqueous component of bile, and vagal stimulation. Cholegogues are the substances that cause contraction of the gallbladder to increase the output from the bile from the structure uh, Okay, so they are called as cholegogs. The important cholegogs are cholecystokinin, causes the contraction of the smooth muscles of the gallbladder, and fatty acids. Functions of bile. Bile helps in absorption of lipids from intestine forming micelle. The bile salts in bile pigment are important. Uh, the bile salts in the bile are important cholerectics that increase the bile secretion. Bile promotes the absorption of fat soluble vitamins A, D, E, K. Bile salts activate pancreatic lipase. Bile pigments bilirubin, biliverdin are responsible for greenish yellow coloration of the uh, gallbladder, so that helps to identify the organ, especially in small animals. So bile salts they are a physiological purgatives. Coming to applied aspects, gallstones, the presence of stone in the biliary tract is called as gallstone or cholelithiasis. Cholelithiasis. There are two types of stones: cholesterol stones and calcium bilirubinate stones. Bile salts, along with lecithin, solubilize cholesterol, so thus they prevent formation of stone in the gallbladder. Factors that favor stone formation are bile stasis. The decreased bile flow or decreased gallbladder emptying facilitates the stone formation. Second one is supersaturation of bile with cholesterol. Third factor is nucleation factor that favors the formation of stone from supersaturated bile. Glycoproteins in gallbladder, uh, mucus from the nucleus surrounding which gallstones are formed. Usually, gallstones are silent stones, but when stones come out of the gallbladder and pass through biliary ducts, severe colicky or spasmodic acute abdominal pain occurs. Chronic gallstones may present with acute cholecystitis. Bile stasis during inflammation of gallbladder. The stone may be induce inflammation and edema of the gallbladder, resulting chronic cholecystitis. Gallstones also may present with obstructive jaundice. The diagnosis is usually made by ultrasound or cholecystography. The plain X-ray may sometimes detect stones. Treatment is usually treated surgically by the removal of the gallbladder, which is called as cholecystectomy. Effect of cholecystectomy. Gallbladder is not absolutely essential for digestive function. These patients, those who have undergone cholecystectomy, maintain normal health and usually their nutrition is not affected. Only problem they face is steatorrhea. That if they eat excess of fat food, the cholecystectomized patient tolerate. Uh, okay, so the cholecystectomy patient tolerate the fat foods to some extent, so it decreases the body fat and may be beneficial for obese people. So this is all about the bile secretion, the regulation of bile secretion, and some of the important applied aspects related. Thank you.